Okay, this is Dr. Prakash. I'm talking about congenital adrenal hyperplasia. There's an excellent association called the CARES Foundation, CARES Foundation. A great place for you to get a lot of information about congenital adrenal hyperplasia. But if you want a 2-minute talk about congenital adrenal hyperplasia, here it is. Okay, congenital adrenal hyperplasia, it's an enlarged adrenal gland which is on top of your kidneys, and that in turn causes an enlargement of a normally small adrenal gland. And why does that happen? That happens because the adrenocortical steroid pathway is interrupted by enzyme deficiencies. Inside the adrenal gland, there are multiple layers of enzymes which results in forming of the cortisol. Cortisol is a life-saving hormone which does multiple things, and the signals for secretion of this cortisol comes from the brain, from the pituitary gland, and that is called as ACTH. So inside the adrenal gland, you will have multiple layers of enzymes, and the ACTH stimulates these enzymes in order to produce the cortisol. So sometimes there is a birth defect of these enzymes. So the enzymes don't secrete well. When that happens, there's a block which happens in these patients. When that block happens, the ACTH keeps sending signals, but the cortisol is not being formed because of this block in between. So they get diverted, just like you see diversions in the road. It gets diverted, and there are more male hormones which are formed. And so these children can present with symptoms suggestive of excessive male hormones, while the production of adrenal hormone cortisol is decreased. And the treatment of this condition as it stands in 2024 is to replace the cortisol hormone so that it will send a feedback mechanism to the pituitary gland not to secrete the ACTH to that extent, and in turn will reduce the secretion of all the male hormones. Now, if this is interrupted for whatever reason, there can be a problem called as adrenal crisis, which can result in hospitalization and sometimes in very serious consequences. Thank you.